Hi everyone, welcome to 5 Minute Videos Review for the NCE. Category 2 Intake Assessment and Diagnosis. And today we're going to cover subcategory S, which states conduct ongoing assessments for at-risk behaviors. Examples: suicide, homicides, self-other injury, and relationship violence. So this is a very important topic because it relates to how to keep the client safe, especially in crisis, moments of crisis, or what you may hear crisis intervention. So, Cannell, first, let's give a definition of what is a crisis, and Cannell, they mentioned that a crisis is a precipitating event. There is a perception of a threat or a damage. There is a emotional distress. There is impairment in functioning, and there's also a failure to use coping methods. So those are kind of the ingredients of what a crisis looks like. Now, there's the notion of the crisis state is when one responds to a crisis event and perceptions of their ability to cope with the crisis event. So the crisis state is that trying to intervene or having a moment where you are dealing with a client or someone, it doesn't even have to be a client, that is in that state. Now the crisis response, that's the notion of seeing things like self-injury, imminent risk, or the intentionality of self-harm or harming others. And this can include, suicide attempts, non self-injuries, things like that. So as far as assessing um, or looking at assessments for at-risk behaviors, you really, as a counselor, really want to measure what that looks like. And part of the reason why you want to measure it is because you want to see the severity. As we talked in earlier videos, this will determine the level of care. If someone is in a crisis, then normally counseling, therapy, or outpatient is not an appropriate level of care for them. So, when assessing risk, consider four things. Look at the intent behind self harm or harm to others. Look at the risk assessments, and look at what level of risk those assessments are indicating. Look at different signs and symptoms. Again, don't just depend on one data point, but look at different data points, as well as consult if possible. And finally, you want to document, you want to talk to your supervisors, you want to involve other people so that there can be a notion of collaboration. Um, Part of a crisis response is having the knowledge in order to know what is and isn't a crisis, understanding appropriate interventions for different crises, being able to remain calm, especially when others are in a state of crisis. That's certainly important. And then looking at those precipitating factors, as well as the risk factors. What are the history? What is the level of trauma? Um, what are the drug use or abuses that you're seeing? What are the physical signs that you're seeing? And also consider the protective factors. So what's the friends? What are the family? What are the connections? How hopeful is the client? Those are all certainly important things for you to consider.